Okay, I just started my shift, so I'm going to go ahead and I'm going to assess this patient. I did a little research before, and it looks like they have a chest tube, so we're just going to go ahead and enter the room. I'm going to knock. I'm going to wash my hands right away. I'm going to introduce myself. Hi, my name is Emily. I'm going to be your student nurse today. If you have any questions or you need anything, let me know. I'm just going to take a little peek at your chest tube here. Could you verify your name and date of birth for me, please, first? I'm looking at his wristband. I'm looking at my thing, and it matches. So I'm just gonna get a set of vitals right away. So took his blood pressure 120/80. His respiratory rate is 16. His temperature is 98.7. His O2 stat is 98%. So everything's looking good. I'm gonna put my gloves on. Did you have any pain at all? Do you have any pain laying in bed? He says no. Do you have any pain while you're standing up, walking around, or anything? He says no. All right, good deal. So I'm gonna go ahead and I'm gonna do my respiratory assessment. So I'm just gonna listen to your lungs. If you could just take a couple big deep breaths for me. Looking for any cyanosis, coughing. His breathing is unlabored. All right, then I'm just gonna check the sides. And then I would listen to the back also, 10 spots. All right, lung sounds are clear, which is good. Then I'm gonna go ahead and I'm just gonna peek at your dressing here. Looking for any shadowing, looking for any signs of infection, any pus or anything like that. I would also, if the dressing wasn't looking good, if it looked a little dirty, I have a extra kit over here, an extra sterile dressing kit if I needed to change that, along with a hemostat and a bottle of sterile water. So everything looks good. All right, I'm just gonna go ahead and press around here a little bit. Let me know if you're having any pain, okay? So I'm just gonna palpate around here. Do you have any pain at all? He says no. All right, I'm just gonna check up here too, looking for any crepitus or any subcutaneous emphysema up around his neck. There. I don't feel anything, which is good. All right, and then while I'm doing that, I'll cover you back up here. I'm just gonna assess the tubing, making sure that all the connections are good and that there aren't any leaks. Looking for bubbling in here because that can indicate that there could be a leak somewhere within the tubing. I'm gonna go ahead and check what the drainage looks like, making sure that there's no pus or abnormal coloring and everything looks good. So I can go ahead and I'm gonna take off my gloves. Just want to remind you that it's really important that you are up and moving every so often, that you're repositioning yourself every 2 hours, and if you're having a little trouble with that, let me know. I'd love to come in here and help you. Did you have any other questions at all? He says no. All right, I'm gonna go ahead and wash my hands one more time, ensure client safety, making sure always that the chest tube atrium down here is always below the heart. It's important that it doesn't go above the heart. So I'm washing my hands. I'm gonna go ahead and document my lifespan. If this was a child or someone who was confused, I would make sure that I asked good questions, making sure that if this was a child, maybe I'd ask their pain level in a different way, or explain to them a little bit more in depth about what we're looking for and what's going on.